Yes, thank you. So we are a small committee, so I'm going to have a more familiar tone of voice. I wanted to go through history because that's the way to understand many things about psychiatry. And first of all, psychiatry is a very complex specialty. And of course, because the brain is very complex, we have billions of connections between neurons. So, and those connections are constantly moving due to the plasticity of the brain. I mean, even interactions between us or this kind of event is changing our brain. And also there are critical periods, meaning that in our life there are periods when plasticity is at its peak, and then you have profound modifications of the brain, for example, during infancy. So it explains why it's so difficult, because when you ask, a patient asks, why am I depressed? There is no simple answer to that, because there are genetics influences, environment influences, the environment during infancy, cultural environment, it's very complex. Also, psychiatry has a bad reputation. And why? Because the history is rather ugly. Because, for example, in World War II, mentally ill patients were killed massively by the Nazi regime, and it's why? It's because they had the notion that all mental illnesses were genetics. Were influenced by genetic, and then the idea that if you eliminate the bad genes in the population pool, then the population is going to be better. And so massive elimination of the mentally ill, and afterwards not better in the other totalitarian regime, the communist regime, because the idea is that social influence is all, genetics plays no part, it's only the environment. And if your social origin was not good, not a worker in a factory, for example, then you had some defect. And also the people who were opposed to the regime were per definition crazy. It was crazy to be opposed to the communist regime, so you had to be put in asylums or killed. And after World War II, it was not so much better in the US, in the United States, because due to the Cold War, there was a preoccupation about spying, and the Americans have been experimenting at brainwashing. They took people, they made repetitively electroshocks, and to eliminate the bad memories, and to reprogram the brain. And of course, the people who undertook, who were part of the experiments were badly broken after that. And you have a recent film, Born in OTT, with, I don't know if you saw it, but it's about this story, in fact, because the hero has been trained to erase all human feelings and to be a trained killer without heart. Also, mostly in the US, after World War II, we had no psychotropic medications, and so one solution proposed was to use lobotomy, and so you had the insertion of a nail behind the eyes, and it severed, it cut through the frontal connections, and afterwards. You see here before and after, but after is not a true image of what would become of these patients, because afterwards they would be simply without emotion and with no real life indeed. But it was very popular after the war. So a bad reputation, and it is no wonder that you have had the emergence of an anti-psychiatric movement in the 60s and in the 70s, and anti-psychiatric movement partly saying for some of them that mental illness were only reactions to traumatic events in life, and so everybody could have mental illness if he has been in bad circumstances. And another type of anti-psychiatrist simply said that mental illness didn't exist at all, that it was all a lie, it was all a social construction to label people with the name of mental illness. And the peak of the movement is due to an experiment done in 1973 by Rosenham. He was a psychiatrist, and he has sent forced patients in psychiatric institutions, and these forced patients would complain of hallucination, and they would be then put in the asylums, and they had many difficulties to convince the professional that they were not crazy, in fact. And it was very difficult for them afterwards to leave those institutions. So Rosenham wrote a paper in Science, being sane in insane places, saying, in fact, that it was asylums that were insane places, and that there was a maltreatment of patients, and that in fact psychiatric diagnosis was not reliable. And just afterwards, and the film, which is very well known with Jack Nicholson, Flew Over the Cuckoo Nest, just after that, the film appeared in 1975. It won 5 Oscars, and it symbolized the fact that psychiatric treatment was inhuman. And for example, here Jack Nicholson is a man who is accused of raping a woman, and to avoid being put in jail, he feigns to be crazy, and then he's hospitalized, put in this institution, and he's rebelling against the authority, the famous nurse who is leading the institution, and then he's punished through ECT, electroshocks, and because he's still rebelling after that, he has a lobotomy, and then there is no more Jack Nicholson, in fact. It's a very popular movie, and fundamentally this movie is telling people that psychiatry is not a real science, and that people are put in inhuman conditions. Also in the 60s you have a very nice song by the Beatles, A Fool on the Hill. I don't know if you know the song, but in some place in the song the Beatles are saying, yes, the fool on the hill is seeing the sun going down, and in fact he is seeing things that other people don't see, normal people don't see. So maybe the fool is not who we believe it is. But perhaps normal people are fools because they are not seeing. They've not the perception of the fool on the hill. And it's typical of the anti-psychiatric movement, saying that maybe it's the society that is crazy, not the people, in fact. And I've put here, with a little humor, a definition of mental illness. Any man who goes to see a psychiatric, because you must be crazy to go to see a psychiatrist. Also, you have, I've put two recent books. One of them is saying nobody's normal, because we live in cultures and people who don't exactly belong to those cultures are stigmatized, and so most people would have at some point of their life problems. And the other books is Saving Normal, and it's a book by a man who has done some, who has contributed to the DSM-4, and he says mostly that we are exaggerating the proportion of the prevalence of mental illness, and that's because pharmaceutical firms have an interest in having more clients, more patients for their products. So let's go to the proof that there is something in psychiatry. There is real science. Mental illness have a basis, a scientific basis, and I'm going to show you some elements about that. The first one is this study, and it has been done in 1976, and it was a study comparing schizophrenic patients with normal controls, and it was the first study with a scanner, and what it showed that patients with schizophrenic problems had something peculiar, meaning that the ventricular size was bigger than normal controls. And why is it? Why is this phenomenon? It's only because the gray matter is diminished, and we know that for sure now that there is a positive connections between regions in the brain of schizophrenic patients, and it explains why there is more space for the liquid in the ventricular, cerebral ventricular. Also, it's a very spectacular image, and you have here monozygotic twins, one with schizophrenia and the other one normal, and it's easy to see which one has the schizophrenic problem, because you have here the diminution of gray matter and enlargement of ventricles. And so the brain of schizophrenic patients is, shows much damage indeed. And I'll show you in a moment maybe an explanation of why there is such damage in schizophrenic patients. Also very important, it's a study in 1995, and a study who has many implications, because it was the first time that it has been shown that a psychological shock, a trauma, could have an impact on the brain, a structural impact on the brain, meaning that when you compare patients with post-traumatic stress disorder, the soldiers who have been to the war and who have had PTSD, there is a diminution in hippocampus volume compared to normal controls. And this is due to the traumatic shock, to the stress, to the acute stress. And so it's very important because it shows that there are not separate, I would say, countries. The structure of the brain on the one hand, and on the other hand, the psychological impacts on the brain. And now we have the possibility to, with imagery progress, to even see connections between a part of the brains. And it's very useful because it's possible to compare, for example, OCD patients with obsessive compulsive disorders to normal controls. And we see here that the connectivity between one region of the brain, the cingulum, and the other parts of the brain are less dense in OCD patients. And it could explain the symptomatology of OCD patients. For many OCD patients are adopting everything. For example, they see that they've closed the door, and they are not sure if the door is closed or not, and they are verifying more and more. And that's because normally you have in the brain a signal. For example, you have the idea of closing the door, and then you have closed the door, and normally you should have in the brain some check signal. Like when you check, you have done something, and okay, check, it's done. And it doesn't function quite well in the brain of OCD patients. And these check signals, not generating an error signal when you have done something well, the error signal is generated by the cingulum, by this region in the brain. So we have now the possibility to have a link between functionment of the brain and some psychiatric disorders. Oh, I'm going to go forward because I don't have much time. But also for the genes, we have now the possibility to look at many genes together, and also to have, for example, the study comes from a study on 12 patients in New Zealand, and they have been followed from the moment they were born till 40, 50 years. And so we have the record of everything that happened to them. And it's possible to see if for example, the events that they have gone through, maltreatment or so, have an impact on what they become. And it has been shown that when you have a certain type of genetic conformation. If there is no traumatic events during your childhood, then it doesn't matter. But the combination of a genetic conformation and of events that are taking place during your childhood, then you increase, for example, the probability of antisocial behavior when you are adults, or of depression. And it's another gene type here, a gene for transport of the serotonin. Okay, I'm going very rapidly through this, but also we know that the expression of genes, it changes when environment changes. And for example, the regulation of stress is profoundly modified by the environment when you have been, when you were a child. And this is due to the modification of the expression of genes. And maybe there is a generational transmission of some characteristics. For example, if your mother has been anxious during pregnancy, and maybe the child is going to be more anxious and is going to transmit it to his children also. Yes, I go through this. We have now the possibility to examine the genome of hundreds of dozens of patients and the whole genome, and to compare and see if there is an increased risk of some psychiatric conditions with some kind of genetic combination. And it is shown that it is indeed the case, but that some genetic conformations give an increased risk to several types of psychiatric conditions. For example, here, for the same genetic variations, increased vulnerabilities for schizophrenia, bipolar disorder, autism, ADHD, depression. How comes? Probably because the environment is different between people, and then they take different courses. And this is illustrated here. You show that you have different genetic conformations, but depending on the prenatal environment and the postnatal environment, then you have different outcomes from the same kind of genetic variations. Okay, I'm going to conclude with one very nice study, because it's the first time in history that we have a clear pathway, a clear mechanism to explain the development of schizophrenia. Of course, it's only a tiny part of the many pathways that could lead to schizophrenia, but it's the first time that we have the complete pathway. And this is about a gene for a protein of the complement, which is part of the immune system. And what is the role of this protein is to mark the connection that must be eliminated, that must be erased. It's like a gardener who is putting marks on trees, saying, okay, this is an old tree, it must be eliminated. And during adolescence, there is a phenomenon that we call pruning. It means that there is a reorganization of the connections in the brain to increase the efficacy of the brain. And during this pruning, the immune system is going to eliminate connections. And when the marks given by this protein are, there are too many marks on connections, that too many connections are eliminated. including good connections. So it leads to what we have seen in the first studies, meaning that the gray matter of the schizophrenic patients is diminished. And the connection problems between regions in the brain of the schizophrenic patients gives the symptoms of cognitive decline, difficulty of reasoning, and also difficulties of communications between perception areas leading to hallucination, for example. So I'm going to conclude. My conclusion, psychiatry is a complex, very complex specialty, but it's also fascinating because it speaks about us. And complexity does not mean that it's impossible to understand mechanisms. And we have made progress, and of course, there is still a long way to go in order to improve that. And perhaps in the future, artificial intelligence might be useful because there are so many factors together that it's very difficult to predict something, to predict the course of for a patient, the prognosis for a patient, and also the most suitable treatment for a particular patient. And we have a recent study for example, using artificial intelligence and putting together many factors in an algorithm and asking the algorithm to learn about the interactions between factors. And this algorithm has been able to predict with good accuracy when people who were traumatized would develop a PTSD afterwards. And it's very recent. So maybe in the future we will be able to improve the prediction that we may make about patients and also the treatment that we are going to give them. Thank you.